Hello, welcome to the Let's Talk Kids Health Facebook Live Show, Episode 4. I'm Dr. Narissa Bauer, your host. I'm a behavioral pediatrician and blogger of Let's Talk Kids Health. The concept of the show is to disseminate information about behavioral health and wellness for children and family. Every week, I plan to bring you topics and guests to help me advance this mission so we can all talk together. Remember, if you're viewing this live, you will have the opportunity to post questions and ask questions of my guest. The replay will be immediately available when we end the broadcast. Okay, so without further ado, I want to introduce this week's guest. Dr. Jillian Wise earned her degree in school psychology at Indiana University. She is currently a pediatric neuropsychologist at CRG, or Children's Resource Group, based in Indianapolis, Indiana. She specializes in comprehensive neuropsychological evaluations for children and adolescents with neurological and neurodevelopmental disorders. She has experience working with children and adolescents who present with complex and chronic medical conditions as well as developmental concerns. Welcome to the show. I am so happy to have you.
Thank you for having me today. I've been looking forward to it since we last spoke.
I know. One of the things that I love about doing this show is that I get to meet up with all my friends and get to talk with them. So I'm so excited to have you. So I know that there are folks watching right now, and I hope that they're going to ask questions. Now, if you do post questions, they're not going to necessarily show up in real time because I'm going to do my questions first. But please, if you have comments, questions, make sure to post them and I will share them with my guest. So I'm going to go ahead and get started.
Okay,
What is a neuropsychologist?
good question. So, a neuropsychologist by training, we are licensed psychologists. So, we really start off our same developmental path as a psychologist. So, going to graduate school and getting your doctorate in clinical psychology, school psychology, counseling psychology. So, mine is in school psychology. But the difference is we have to make sure we get some specialized training in neuropsychology. So, learning about the brain and how it develops, getting assessment courses for the tools that we would use to work with children and adolescents. And then we do our year-long internship just as other psychologists. The difference is afterwards we do a 2-year postdoctoral fellowship in neuropsychology where we then specialize even more into different medical conditions, the brain, how the brain develops and then impacts our behavior. So the primary difference is really understanding the brain and the different brain areas and functioning and how difficulties in those areas can impact behaviors.
Yes, thank you for that. I think there's a lot of, kind of questions or people don't really know that there's a difference there.
Mhm.
Do you have other additional training when you want to specialize with working with children?
So yes, so when we kind of go through the process, obviously I was in school psychology, so I knew I wanted to work with children
Hmm.
early on, but then you really do start to differentiate in tracks in terms of pediatric or adult neuropsychology. So my postdoctoral fellowship, that 2 years, was in pediatric neuropsychology, where I'm really learning about children, their development when they have a medical condition that affects brain functioning. How can that impact them now and later on, which is very different than somebody who's has adult training. They learn about different conditions, Alzheimer's and things like that, that I necessarily don't have experience in. So there certainly are differentiation. I know I sometimes have to talk with individuals about, oh, that's more appropriate for an adult
Right.
neuropsychologist rather than a pediatric one.
Right. Well, again, thank you for clarifying that. And I think the next question is this is a nice lead in. So, when is a neuropsychological evaluation recommended versus psychoeducational testing?
That's a very good question because sometimes I think it's unclear. And so at CRG, we try to, in our intake process, figure out if somebody's seeking a neuropsychological versus psychoeducational evaluation, but sometimes it's not known. As a general rule, a neuropsychological evaluation tends to be recommended for individuals with medical type conditions or treatment that could be impacting their brain functioning. So we think about cancer, seizures, concussions, things like that. Those types of conditions tend to lead on to a neuropsychological evaluation because based on our training, we're trying to figure out how are these impacting their learning? How are these impacting their attention? And by doing that, we use a pretty comprehensive testing battery to look at all areas of functioning. So IQ or thinking skills, academics, attention, memory, motor skills, language to get a good assessment of what's really going on for the child.
Mm-hmm.
Whereas a psychoeducational evaluation tends to be referred when there's primarily a school difficulty going on, so reading, writing, math, or dyslexia, and they're coming for an evaluation to figure out how can we help this child in school. And then the battery tends to be more focused on cognitive skills, academics, and things like attention, and also emotional functioning, anxiety, and depression. So it's just not as long, I guess, of a day and less testing measures, but it tends to be we try to find out, does somebody have a medical reason for a neuropsychological evaluation rather than a psychoeducational.
Yeah, and that makes sense. Thank you for clarifying that because I think even among providers, w- they may not know the subtle differences and or if when it is appropriate to make a
Mhm.
specific referral. So if someone were to call CRG, um, is that something that is covered over the phone just to be able to make sure it gets to you if it's appropriate?
It's attempted to. It's not
Hmm.
always the case, but we
Yes.
try to, our intake team tries to get what's the reasoning. If they have the word neuropsychological evaluation,
Hmm.
they tend to get referred to me for an intake regardless. And then I have a conversation with the family. Is this really what they're looking for, or is it more a psychoeducational one? And then I can help them along that path if it's not necessarily a neuropsychological evaluation. So we do the best we can, I
Hmm.
think, to figure it out along the way. Sometimes there are individuals who don't have necessarily a medical condition that leads them to ask for a neuropsychological evaluation, but sometimes parents want more information about their child's functioning, about their planning and organizational skills, about their memory,
Hmm.
strengths, and challenges. And that type of testing we can get from a more full neuropsychological evaluation day. So there will be those cases where there's not necessarily a medical component, but somebody's seeking that more kind of comprehensive testing day.
Huh, that's interesting because I actually didn't know that. So is there a difference then, I guess, in terms of insurance,
Yes.
if you're doing it for that reason versus like a child who had cancer?
Yes, because so for neuropsychological evaluation it tends to have to be medically necessary.
Yes,
So if somebody doesn't have that diagnosis and a code to bill under, and somebody's wanting that, insurance likely will not cover
cover.
the evaluation.
Okay, thank you.
Yes.
Well, I think we sort of covered this
Mhm.
question, but maybe we can recap that, especially if people are just joining.
Mhm.
So, what types of patients do you tend to typically see?
Mhm. So I see kids across the range of different medical conditions. So histories of seizures, history of cancer that's required treatment that can impact their brain functioning, brain tumors, genetic conditions,
Hmm.
concussions, prenatal exposure, prematurity, things like that tend to be why individuals are referred for neuropsychological evaluations.
Okay, great. I wish that we had a checklist like that for providers because, when we're thinking through that, that would be really helpful.
That would be a helpful thing to
Yeah, maybe we should put something like that together.
I think that's a good idea.
See what happens? We just, start brainstorming. Uh, all right. And then I have one additional question, then I'm going to turn it over because we are getting some comments and questions, which is awesome. And what I was hoping.
Great.
So, what to expect on the day of testing, right? And I know that testing in general can be a very long and sometimes multi day process. So,
Mhm.
what can families expect? And then, what do you typically recommend that families tell their child to prepare?
Absolutely. That's a good question. And I try to do my best when I'm meeting with families for that intake to describe what the day is going to be because it is a full day. So I tend to do my neuropsychological evaluations in a 1 day sitting. So they start in the morning around 8:30. We take an hour break for lunch at noon and then come back and usually finish a couple of hours of testing afterwards. So it is a full day. I encourage parents to send snacks, drinks, we take breaks. But while it is a full day and sometimes parents will be a little bit hesitant, I do explain to them too that it's helpful for me to see how a child does throughout the day because a child's at school from 8:30 to 3
Hmm.
and they're not just there for those 2 hours. So it's very helpful for me to be able to speak on how they're doing in the afternoon versus in the morning. So the first part is I talk with families about, yes, how long of a day it is. But again, we try to take breaks, make it as enjoyable as possible. If they do need to break it up into a 2 day or few day session. I'm usually able to tell that sometimes during the intake, just based on the child and activity level and whatnot. So I try to prepare them from the front end as far as how long the testing is. And then I'm during that intake session really trying to build rapport with the child, with the family, just letting them know that, and sometimes parents explain this to the child, or sometimes I do, but just let them know there's nothing you can do to prepare for the day. You just get a good night's sleep, eat a good breakfast, and all you have to do is try your very best. And let them know some things might seem super easy, other things are a little bit more difficult, but all you have to do is try. Some things seem a little bit like school, so answering questions, reading. Other things are different, working with blocks, looking at puzzles. So we mix up the day. So it's trying to let the child know what to expect is the best thing. And sometimes parents are having questions about, what will my child say when I tell them that they have to have this? And I usually say, the goal of it is just to find out how they think and learn so we can help them in school or help them with friends or help them at home, because kids tend to know that something's going on. They know why mom is meeting with somebody because of school's hard for me. I'm having some behavioral troubles with friends. And so we just let them know the whole point of this is so that we can help and make sure that they have everything they need to be successful.
Right, right. And I guess I'm going to ask this question because, we're living through a pandemic. We've had to make a lot of adjustments. And I assume, telehealth, it has become something that we are all sort of doing in some capacity. I mean,
Mhm.
how has that impacted? Because I can only imagine that you really do have to do this in person.
Yes. And so for we do so yes and no. For neuropsychological evaluations,
Hmm.
I do have to do in person just because I'm not able to do all the testing remotely. We have manipulatives and things like that. Right now we have plexiglass shields, of course, mask wearing and things like that. Now, psychoeducational testing, there are many measures that can be done remotely, but it really has to be with the right patient or client.
Yeah.
Um, and ability for them to function in a remote type setting. But how we're doing it right now is our intakes are virtual and our follow-ups are virtual. And really, it's been working well because at the intake, I'm able to meet the whole family.
Mhm.
Oftentimes, it's mom and dad, depending on somebody may be in their office, whereas when they're coming in to meet us, it might just be one parent or guardian given their scheduling. So I feel like I'm able to see more and hear more about concerns. And same with the follow-ups, I'm able to be able to speak with more parents at the same time. And at the follow-up time, I always just act like they're in my office. I share my computer screen, walk them through the report, show them the scores as if they were just here in my office looking at the testing scores.
Right. Well, there are a couple viewers that actually said good morning. Very nice. Thank you. And another, oh, Dr. Hess, thank you so much. I appreciate that. So I love when folks kind of jump on and say, hey, I'm here. So my other question, though, to you
Mhm.
is um, just about that. Like, how long after you do the testing
Mhm.
is it typically before a family can expect meeting with you to go over results? Is question one. And then the second part of that is, do you ever sort of interact with folks at school or do any of that advocacy on behalf of the family?
Yes, that's a good question. So as far as the timeline for evaluation, so once they come in to do our testing, the goal is for them to have that follow up with me within about a week and a half to 2 weeks to go over the results.
Okay.
I don't finalize the report until we talk at that time, just because things can come up between intake and follow up, but then they get the report within the next few days after our meeting. So we try to keep that pretty quickly. And then, yes, so I always tell families I am available to help participate, whether they be in case conference meetings, consultations with the schools, school observations if possible. Right now, it's hard. I know I've talked to schools about doing virtual observations and things like that because I know a lot of times we get this report and then it's always where do we go from here.
Right, right.
And sometimes parents feel very confident about what their next steps are. Others, we check in, we end up that follow-up meeting with another meeting scheduled in 2 months just to check in and bring it back together. Other parents do set up a school meeting and I used to be calling, but now that everyone's more comfortable, I think with video conferencing, I'm able to use GoToMeeting or Zoom to join the conferences with them.
Yeah, that's great. That's great. Actually, we do have a question here. I'm going to put it up on the screen. Thank you, Becca. So she actually has a question here about, can you talk a little bit about how a neuropsychologist conducts sessions with children after a full evaluation, and what kind of things do you work on with the child?
That's a great question. Thank you, Becca. And so it depends on the neuropsychologist. So at CRG, I will continue to see the families afterwards. Just my schedule allows me to help with things, whether it be anxiety, coping with changes medically. So we've had a concussion, we're dealing with what's going on, anxiety related, returning to school and things like that. But it can also be working with families as terms of behavioral difficulties. So challenges are going on with behaviors because there's a reason for coming for a neuropsychological evaluation.
Mm-hmm.
Typically, is that something's going on at school or at home. So I like to continue to be available to meet with families, whether it be on a monthly basis or what works best with them to troubleshoot what's going on behaviorally. And then if it's appropriate for the child, working with them to develop some coping skills, working on impulse control and things like that. So I might be a little bit different in terms of neuropsychologists who is able to do that post evaluation. I think it does just depend on the person's practice and what they're able to do in terms of whether it's just solely testing or also working with families.
Okay, great. And it looks like we have another question from Julie. So, what types of treatments do you recommend for children following diagnostic testing?
Great question. And so many times I have in the report are recommendations for the school setting and then recommendations for the home or personal setting. For schools, I might talk with the families about getting educational plans in place. So a Section 504 plan, which will allow accommodations, or talking the families through an individualized education program or IEP to make sure we're getting the right supports in school. And within that section that I outline, how would we address attention in school? How might we address reading difficulties and things like that? For then the other resources, it may be I point to physical therapy or occupational therapy if we have motor types of concerns, or counseling or psychotherapy if there's difficulties with behavior management, anxiety, depression. If we make diagnoses for attention, we may recommend talking with a physician about medication management to assist with treatment.
Mm-hmm.
Those are the most common types of recommendations. Social skills groups, if I think that they're appropriate, are things I would talk with families about. And so the goal of the whole process is to meet the child's needs so that they can be successful. So whether or not it's school types of supports that they're needing, or is it more at home? How
Right.
do we help them or outside of school?
It looks like we have another question, but before I get to that, I do want to ask you, for those folks watching, they might not know the difference between an IEP versus a 504. Do you mind sort of going through that really quick?
No problem. So a Section 504 plan is through the American with Disabilities Act, and what it allows is educational accommodation. So there's no special education services, no real pullout for the child to get help, but it's for things. So if somebody has ADHD and they need extra time on tests, testing in a small group, opportunities to move around, we might recommend a Section 504 plan, or somebody who's just coming back from a concussion and we need some accommodations until we're back to our typical self.
Mm-hmm.
So there's not huge changes going on, just more kind of environmental accommodations. Whereas an IEP or individualized education program is accessing special education services. So working in the resource room on things like reading, written expression, mathematics, getting additional small group help. And so it's more changes in actual services that the child's getting: occupational therapy, speech therapy. A child would need an IEP for rather
Mm-hmm.
than a Section 504 plan. And so I have conversations with families about that as far as what I think might be appropriate and what's a good starting point for them. And once one's in place, then it has to be reviewed annually by the school and the family. And many times I'll have families contact me at that annual time and just send me what the updated one is or ask if this looks appropriate and things like that.
Yeah, that's great that they, once you see a family, they know that you're still on their team,
Yes,
and you want to stay involved.
absolutely.
Yeah, yeah, that's great. And let me just go ahead and share this other comment here. So I have twins, both with ADHD, but one of mine lacks the impulse control, um, and he has ODD. Would this be more of a neuro evaluation or a psychoeducational one?
That's a good question. And so he may be able to get the answers he needs from a psychoeducational evaluation as far as the diagnoses of ADHD. Now, because we're looking at that medical kind of diagnoses that go along
Hmm.
with neuropsychological evaluation, because then that testing day would look at looking at their overall cognitive skills, so IQ. We'd still be looking at attention, looking at it, academics, as well as then getting rating scales to look at the defiance, the behavioral difficulties. And through that psychoeducational evaluation, you would still get the same types of recommendations as a neuropsychological one as far as school, home, environmental types of things. So for him, I would likely start in terms of a psychoeducational evaluation. If you're in that intake process, and I know my colleagues do a nice job, if they're in there and it seems like a more complex case, then that tends to get passed on to me for the actual evaluation if we think, we're not going to get all the answers from a psychoeducational one. But for that specific case, that's probably where I would start.
Okay. Yeah. So, I mean, I guess can I piggyback off of that? Because I was curious when I make referrals for testing, um, what is the typical time frame if you have to repeat, or is there ever, you know, the situation where you need to do a repeat in a few years?
Yes, absolutely. So we want to wait a year between
Hmm.
tests. So if I will get referrals from the school and if they've had an IQ test within the year, I don't redo either that same one, I do a different one, or I just use kind of the schools to help the family with interpretation. But we do recommend waiting at least a year
Okay.
between follow up. If not, and I don't think many kids or all kids need something annually as far as testing. I always talk with families before big educational transitions. So before third grade, before middle school, before high school to reassess where they're at, what types of recommendations would we have moving forward in these big type of school changes.
Okay. And would that, when you say that, would it be another battery of neuropsychological testing or psychoeducational testing?
If they've had neuropsychological evaluation, I would do another neuropsychological evaluation because we're wanting to assess for change in
Right.
their functioning across the board. Sometimes kids will, so kids who've had treatment for cancer, we will test them every year to look at if they're losing skills or if there's any regression or slowing in processing. So for certain populations, I do recommend annually, but that's not always the case.
Okay. And then I guess piggybacking off of that with so many of my families where we're in this sort of kind of fork in the road decision. Okay, we think we absolutely need to get testing. Would you recommend, and what I normally do is tell them to reach out to the school first, especially if it's going to be more the psychoeducational route. However, like uh, sometimes there's that question, well, should we pursue outside testing? And what sort of advice do you have for families who are like, well, which way should we go?
It was a challenge because a lot of times insurance, especially psychoeducational evaluations, they may not cover the all of the testing or any of it. So there's always that component of financial burden. So
Hmm.
I think it's a good place to start with the school and find out what's the timeline. So schools do have those 50 school days to
Right.
complete their assessment, which if we're starting in February, it can be towards the end of the school year before the testing and case conference is wrapped up. So if we were needing something sooner, it might be better to do things kind of privately or outside. But then also having the conversation with the school as far as what all will the testing entail? Because sometimes they don't, or many times they don't have to do like a cognitive or IQ type measure. And also through a school evaluation, there won't be a formal diagnosis. So there won't be a formal diagnosis of ADHD, but it can come from a physician outside, or there won't be a formal diagnosis of like a specific learning disorder because that has to be done by a licensed psychologist. Um, it's kind of a roundabout way to answer that question because it's hard. And I
Yeah.
with families, but I think the biggest thing is to always start with the school to see what all will be assessed.
Hmm.
And then if we don't think we're going to have the answers from there, I might seek an outside evaluation. Or is the timeline going to be too long and we really need to get some services going?
Okay. Yeah, so I guess that's a great consideration because we're in February now. What if families like decide, "Wow, I really should get on this after viewing this show with you." And
Mhm.
then, you count the 50 business working days and we're going to be out of school. Like let's say we're going to be out of school. Do you still suggest that they go ahead and put in that request or should they wait until the beginning of the next school year?
I would put in the request. So as soon as you're concerned, I would start that process. And even if along the way you decide as a parent you're going to do an outside evaluation, I would talk with the school and let them know, because something to know is that schools do not have to accept outside evaluations. They aren't required to. Many times they do, and I think it's helpful for them to have that, and then they may have to supplement by doing their systematic observations in the classroom, but they don't necessarily have to accept an outside one. So I think as soon as you have a concern as a parent, talk with the school, find out their timeline. If you decide that's not going to work and you're going to go through an outside evaluation, letting them know that that's going to be the case, because we don't want it to be kind of, we're coming here and telling the school what we want to do. It's working together with the school for the best of the child. That's what I want to do. I want to be able to communicate with the school to help them. So I don't want to be an outside person saying, here's what I think you should do. It's more so, here's what we saw. What are you seeing on your end, and how can we best support them?
Right. Well, it's interesting that you said that some schools kind of don't accept outside evaluations. And I think it's really helpful for parents to sort of advocate and ask those questions ahead of time before spending the money. But do you find that neuropsychological testing they will more often accept, or does it vary?
I've found that in most cases they accept both type. I've had good experiences in working with the schools accepting it. I think neuropsychological evaluations might be easier sometimes for them to accept it, because it's just such a different type of testing, and it's helping them understand their medically complex student a little bit better. And so it might be easier for them to accept a little bit. But for the most part, I think schools have been fairly good about accepting some of the recommendations, or if they're not, then kind of clarifying as to why. And then I work with a family as, okay, well, let's see what supports we are able to get, and then again revisit it within the next year, because once you get something put in place, you have to.
Right, right. I'm going to share a testimonial because it's so beautiful. Oh,
Thank
Dr. Weiss saw my
you.
college freshman daughter for the first time diagnosis of ADD. This has helped her tremendously and to get her on the right track. We love you, Dr. Weiss.
Thank you. Nice
Well,
to hear. I'm
oh,
glad
what a
it's going well.
glowing recommendation. Thanks, Lorraine, for joining the show. That's so great.
Great. I like to hear these types of things, because when things are going well, that I don't tend to know what's going on, because then I want things to be going well for children. So that's nice to hear. Thank you.
Yeah, that's really wonderful. So, I am going to continue on. So I don't have any other questions currently, but again, if you're still watching this live, we have a few more minutes, so feel free to throw up your comment or question. And so I'm going to go ahead and switch us over. So I mentioned that you are at Children's
Mhm.
Resource Group. Do you mind telling us a little bit more about that organization and maybe what services you provide?
Absolutely. So we are a multi-specialty behavioral health practice. So I'm the only neuropsychologist that's there, but then we have several other psychologists who do psychoeducational evaluations, therapy, looking at autism. We have certain psychologists who specialize in the area of autism as far as assessment and diagnosis, as well as treatment. But we treat individuals across the lifespan. So even though the name is Children's Resource Group, we have individuals there who work with families and adults to help support them therapeutically, testing wise. We have medical providers to work with psychiatric treatment as far as medication management and working with families across that way. We have a ADHD life coach who works with individuals with ADHD, career training, and things like that. We also have social skills groups. So there's many different providers who we have to hopefully help along the way. And if we don't feel like we have the right person for you, we are able to recommend outwards if needed. But I think we've got a good team going. I've been working there for about 2.5 years now,
Mhm.
and I've really, really enjoyed it.
I can just imagine that there's not a lot of neuropsychologists across the country. I mean, what is a typical, and I know yours is unique, but
Mhm.
what is the typical wait time to see you?
That's a good question. So I would say right now, as far as if you call to get an intake, it might be a couple of weeks to
Hmm.
get in there for an intake appointment. And then after the intake, maybe another 2 weeks for the testing day. And then again, 1 to 2 weeks afterwards. So from this, sometimes we can get things quicker, but I would say it shouldn't be longer than a month and a half for the whole process as far as intake, testing, and then follow up to go. But we like to get things through quicker as possible. Now in larger medical settings, the wait list can certainly be much longer. I think that's one of the nice things about private practice is that we are able to get individuals in a little bit quicker.
Yeah, that's great. I mean, I wasn't expecting that. I mean, I that
Mhm.
sounds not long at all. I mean, compared to when I've ones I've heard.
Yeah.
It looks like we have another question from Chris. So no problem about another question. My oldest son is 12, and we did outside testing when he was in third grade, and it came back severely dyslexic. Our school had to do their testing and also took our outside testing in consideration. However, with the pandemic, the IEP is not being followed, and he is at the point and so overwhelmed that he just shuts down and doesn't do anything. The question is about emotional functioning. Thank you for this question because um, I think we've all seen the negative effects of the pandemic on the social, emotional, as well as academic functioning of our kids. What do you have to offer, suggest
Mhm.
to this family and others in the similar
It
situation?
is so challenging, especially for students with IEPs. And I think the big thing is to talk with the school first about following the IEP and making sure he's getting the support that he needs. Because for him, he is getting frustrated. He struggles with reading as he is. And then if we're not fully getting the supports, shutting down is what kids do because kids would rather not do it than try and fail. And for him, he might be thinking that if I try, I'm just going to fail. So I'd rather not. And then it's my choice. So emotional functioning for him is certainly a challenge. And I think listening to him is one of the key points and talking with him about tips and strategies he can do when he starts to feel this way. And if you as a parent can start to recognize when he might be shutting down, taking a break, walking away, doing something that's calming and relaxing, trying to have him talk. Kids can't always talk about their feelings right now, but trying to give him the words that he can and then coming back to it. But I think the biggest thing I would also recommend is talking with the school because it's such a hard time. And I know schools are trying to figure out what to do as far as implementing IEPs virtually.
Yeah, I mean, I feel for the schools, I feel for the families. It's just really tough, right?
Yes.
Um, oh, and follow up, that's exactly it. He rather would not do it and try and fail. Oh, I mean,
And
yeah.
it is so hard.
And I think to your point is just having that conversation, not when everybody's emotion is heightened,
Mhm.
but really sort of just allowing that to sort of settle and when he's calm, like just having that honest conversation so
Mhm.
that you can meet him where he is
Right.
and then maybe sort of have a game plan to then engage with the school and have that discussion. Like, what can we do? Because
Right.
he clearly wants to do it. We need him to do it.
Mhm.
How can we get him there?
Absolutely.
Yeah. Um, Seeing a neuropsychologist was one of the best things we did to understand his asynchronous development of my kiddo. That's fabulous. Thanks, Caitlin. Yes, asynchronous development. Can you explain that concept? Uh,
And so sometimes we have these children that some skills are developing quicker than others and others are lagging behind. And I think a neuropsychological evaluation can really help understand the child's processing.
yep.
So where while one developmental area may be average or above, and it could be masking some challenges as far as helping them really understand, okay, what can we do to build up these other areas of difficulty?
Yeah. Oops, let me just show this other one. So I think we have some thank yous. Thank you, Julie. Thanks for watching. And then Chris again, thanks so much. Oh, this is so fabulous. I love it. um, so again, I think we're almost out of time, but I will just go ahead. Is there anything else that you want to mention, Jill, as far as that we didn't touch on or through our conversation?
I don't think so. I think as parents who are watching, I think if you have additional questions, reach out, talk with your physician about
Mhm.
if they would recommend testing and then having a conversation with whether it's a psychologist or a neuropsychologist. You know your child the best. A lot of times when I talk with parents about the results, they're saying, "Oh, this is exactly what I see." And I tell them, "Well, I don't tend to want to surprise you. You know, you're the specialist in your child. You know them,
Mhm.
but we're just giving you then what you need to help advocate for
Right.
them." So I really think that a full evaluation can be helpful on so many levels for kids, whether it's in school or behaviorally to help them be successful.
And again, Caitlin said, yes, the masking was seen as lazy quite often, and having an expert report helped us within the school.
Yes, I
Yeah.
talk with parents about that as well as it can be a struggle because we think they're just not trying, but a lot of times it's because we actually can't. Kids want to do their best when they're
Right.
with them for the most part. And so it's helping them to be able to do so.
Right. The other, I guess, before we wrap up, because I'm just like thinking of all these additional things. So it's interesting because if we talked about some of the more common populations, but do you ever find that sometimes kids with like diabetes, asthma, sometimes make their way to you, maybe because they're having problems in school, they have chronic conditions,
Mhm.
how do we ferret that out? Like I guess for us as providers.
That's a good question. So I have not specifically asthma, but for diabetes, I have had
Mhm.
individuals find themselves to me for testing because, especially if there's uncontrolled diabetes, I mean, that can affect learning and thinking, and the stress that goes hand in hand with a chronic medical condition can also impact their functioning. So, yes, they have found their, I can't say, I mean, I guess kids have come and they have asthma. It tends to be more of a side diagnosis
Mhm.
in combination to other things, but I have had kids with diabetes come through and things like that that we can still help parents navigate what's going on too. But I think for some of those populations, it's a big emotional
Right.
piece, anxiety and dealing with differences and changes and things like that.
Right. Okay. Well, thank you. Sorry, and it looks like we might have one more comment. Oh, another testimonial. We had a wonderful experience working with CRG for two of my elementary age school kids who are now diagnosed with ADHD. I often recommend CRG to friends. Awesome.
Thank you, Kristen.
I know. Isn't that fabulous? I mean, word of mouth is just the best, isn't it? I mean,
Absolutely.
yeah. Well, wow. This is making me feel so good. This is like a good, high that we're on
I
on a Friday morning. Woo! You've helped so many families, and it sounds like they all are here supporting you and so excited to see you on live. So it's great. Ah, well, I have just had such a fun time talking with you this morning.
Thanks for having me today.
And remember to, like, if you have any other questions, or you can always reach out to Dr. Wise, and we showed you the website. So I'm going to just tell you that next week our special guest is Brian Ray, children's book author, where I'm going to be talking with him about children's books as a way to start a conversation with kids. And be on the lookout when I do post that we're going to go live, maybe later today. There's going to be a free book giveaway. So for his most current books. So please pay attention to that. And so I don't think I'm making sure that there's no additional questions. I don't want to miss out on any. Okay. So, if you have any suggestions for future guests or topics, please do feel free to reach out to me at my email, which is letstalkkidshealth@gmail.com, or drop me a comment below, message on social media, and remember, consider subscribing to my YouTube channel, Narissa Bauer MD, to be alerted when I go live each week, or follow my Facebook blog page. So, thanks once again for
Thank you.
joining today. It was so fun, guys. Everybody like commenting, asking questions. That's exactly what I love to see.
Yeah.
And again, thanks again.